All right, this is Paul Albright, Chief Military Officer for the City of El Paso. Today is the 19th of September. It's 10:08 a.m. I apologize for starting just a little bit late. All right, we had to get the new Teams link up and running, and plus the City TV link. So now we're ready to go, and so we'll get started. Today we got a great meeting ahead of us with a great agenda. We'll get started with the call to order. So let's get started with District 1, Ryan Kanoff. Present. District 2, Ron Jackson. Present. District 3, Donald Juarez. Present. District 4, Roberto Garza.
Present.
District 5,
Present.
George Ellisesser. District 6, Miguel Rosales.
You mean Don?
Don. District 6, Don Brown. District 6, Don Brown. Don Brown said that he would be absent. And District 7, Miguel Rosales. District 7, Miguel Rosales. District 7 is absent. He hasn't called in. And our mayoral appointee, Ruben Ramirez. Ruben Ramirez called in saying that he wouldn't be able to make it either.
Okay.
So with that.
And I'm present.
And District 8, Melissa Harcrow is present. Melissa, you have a quorum. You may go begin.
Okay, thank you. Let's start with the Pledge of Allegiance. Mr. Kanoff, will you please lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, item number 4, discussion action to approve the minutes of July 18th, 2024 and August 15th, 2024. Do we have a motion to approve?
Motion. Second.
All in favor, say aye.
Aye. Aye.
Anyone opposed? Okay, so the minutes for July 18th, 2024 and August 15th, 2024 are approved. Item number 5, citizen comment period. Individuals limited to 3 minutes. No specific action may be taken. Do we have anyone signed up?
Nobody has. Madam Chair, nobody has contacted me or sent an email, and I don't see anybody in the audience either that is here to speak on citizens' comment.
Okay, thank you. Item number 6, El Paso VA Healthcare Clinic update. Director Freud Garza, I know he's out.
So I've sent it, Tracy Arnsman's on from the VA.
Okay.
Assistant Director, she can go ahead.
Good morning.
I sure am. This is Associate Director Tracy Arnsman. Good morning, everybody. So just to give everyone a heads up, we did break ground on August 28th. It was a great service led by Mr. Albright. So thank you so much for emceeing that for us. You did a great job, and we appreciate that. It was very well attended, and they actually started construction on the 30th, so that Friday. We have been meeting with our construction and our architect folks actually just this week and getting a lot of headway. The goal is, of course, to come in early and under budget. So we're staying on top of all of that, and we could not be more excited. If any of you have not been over here and seen the rendering or the video of our new facility, please come by and see it. It is going to be beautiful. And when you get a chance, if you'd like to, and in fact, we can send invitations if you're interested in meeting any of the team when they're here. They will be here on a monthly basis going forward. So if anybody is interested in seeing any of that, just let me know, and we're happy to coordinate that. If anybody has any questions, just let me know. Otherwise, I'll say thank you so much.
Excuse me, does anyone have anything for Ms. Aaronsman?
I do.
Okay, go ahead.
Ms. Aaronsmith, George Ellisesser, District 5. Up front, this is not a criticism. This is just FYI for the El Paso VA. I've been doing a small sampling, anecdotal sampling of veterans in my district. There's a lot of them that are just still disgruntled with the service at the VA. But the one thing I found out that was common amongst all of them is that these stories that they told me are from several years ago. And they kind of just walked away from the VA. So just FYI, I think it would be, I'm trying to do my part to bring them back in because I think the VA in El Paso, since I've been in the program for the last 4 years, has done a tremendous job. But just be advised that there are some who have walked away from or just go to their appointments and try not to stir the pot because they don't think they're going to get any results or any actions. And it's unfortunate, but I think if we could do something to kind of remind them, hey, the VA is here for you. El Paso VA has made strides, and we're here to help you and help all veterans and kind of bring them back into the program. And it's just a little FYI for El Paso VA. Thank you very much for what you do.
Well, thank you. And as a veteran myself, I mean, we always try to get that word out, how much we have changed. I mean, in the 7 years that I've been out here, I have seen a huge improvement out here, not only here in the facility, but in how well we are received. However, there always is room for improvement. But we appreciate the partnership with everybody out in the community, and we're going to continue to get the word out with our changes and everything. What we would ask everybody is that every first Thursday of the month, we do have a teletown hall, and we like to share the information as much as we can. We open up that platform for questions and give and take with our veterans. We send out over 10,000 calls, and we open the floor, like I said, for questions, and we take those questions live. And it's a great opportunity, especially for those folks that have not been at the VA recently or want to give feedback or just, you know, even voice a complaint. We're there to hear that and address those concerns and complaints. So if you can help us share that information, we do post it on our Facebook site as well, the call-in number. So if they're not getting the call, they can be added to the call list at that time by dialing into that initial call that's posted on Facebook. And we're always happy to get them added to that roster. So that's an opportunity there as well. But we're going to continue to keep reaching out, and we appreciate your partnership in helping us get the word out there too as well. Anything else?
Did you have something, Donna?
Good morning. I was going to save this for my mental health component. But one of the things that I think all of our veterans that are service connected, we got to remember over 20,000 veterans in this regional area are still not service connected. So we have a lot of work to do. Any veteran watching this, they need to just check in with the VA and see if they want to get connected. But I think one of the most remarkable things when you think about mental health and you think about being all the consequences to not getting access to services is your whole health program, your peer support groups, your the IOP, the inpatient, all of that stuff is all designed not just for mental health counseling by a licensed therapist, but also peer support and social connections and all of the things that we hope people embrace so that they have a hope and a vision for the future, not just education and employment. And so if they understand that you guys have a wraparound and that we just preach that and that we send that voice out there loud and clear, it really does make a difference. And then, so that's was one of the things I was gonna say in my mental health component, but, you know, really looking at protective factors, not just the medical, not just the mental health, and you guys are doing a fabulous job, and we're gonna do what we can to try to get people service connected so that they can see the new VA and what you guys have done.
Thanks, Donna. And, you know, the other thing specifically to the mental health capacity is that they don't have to be an honorable discharge. We will see anybody that is in crisis. We will see any veteran that, whether they're OTH, any veteran that needs that behavioral health assistance, we will facilitate that. So if we can help spread that word as well, I think that's important to share as too. So if you can help with that, we'd appreciate that.
Go ahead,
Anything
Roberto.
else?
Yes.
Yes,
we-
ma'am. Roberto Garza from District 4. Is it possible to create, or maybe you have a document already that says, hey, you don't need to be service connected to get mental health services at the VA that we can share with our organizations and veteran community? Because, word of mouth is not always the best way, but if you have something like, when you guys came up with the program for, walk-ins, y'all made a flyer type of thing. So if you can make
No,
another
that's a
type
great
flyer,
idea.
we can share that and get that word out, because we're definitely trying to get to zero, and we can't get to zero if the community doesn't know about it. Thank you.
Absolutely, we can do that, and we'll include that crisis information as well. And that crisis information, you don't even have to be a veteran. If we will see anybody for crisis intervention as well.
Does anyone else have anything for Ms. Aaronsman? So I have one thing. So at the Borderplex Summit, Miss Angie hinted that a women's claims clinic might be coming. Is there anything you can say about that?
A women's claim clinic.
Or something.
So you mean our women's dedicated clinic? I know we're right there on the cusp of that one, but the women's claim clinic, I haven't heard that, but I'll get with Angie and let you know.
Okay,
Melissa,
yes, no problem.
I'll email you that and
That would
see
be great,
and
yes.
connect those dots.
Because we had one of the, I forget which VA system exactly had one, a women veterans claims clinic. And I mentioned that it would be awesome to have one here. And she hinted that something is kind of in the works, but I don't know.
Right, because our goal for this year was to surpass 5,000 women registered in El Paso, and we're at 4,961. So we're so close to meeting that 5,000 goal for this year.
Awesome.
That would be so cool if we do that.
Yes. Okay, thank you.
Uh-huh.
Okay, I don't think
Anything
there's
else?
anything else. No, ma'am, nothing else. Thank you,
You know,
so
I can
much.
talk about the VA all day, but I don't want to hijack the whole meeting. Sorry, Paul.
Yes, ma'am, thank you.
Thanks.
Okay, item number, where am I? Number 7, excuse me, El Paso County update, Veteran Assistance Program Manager. I know Tony's not in. Do we have anyone online? No, okay. County is MIA. Item number 8, community update, El Paso VA Healthcare Home Health Presentation. Good morning.
Excellent. Woo.
Change the slides. Now you're changing the slides on that, but they're not, there they are.
Okay, good morning, everybody. My name is Laura Escobar. I am the nurse manager for the non-institutional and extended care programs here at the El Paso VA. And thank you so much for the opportunity to speak to you guys about one of the programs. I think our last slide will talk about the rest of the programs that are under NIC. But specifically, I think there's been a lot of interest, and I definitely want everybody to be aware of our Home Health Aid Personal Care Services program. All of the programs under the NIC department really aim at allowing a safe placement at home for veterans as much as possible. We know that research shows, evidence shows that when someone is at home in their own environment, for the most part, for most cases, people do best. It's better to be surrounded by your loved ones, by your own environment. So all of these programs aim to do that. This personal care services, we can do, I don't have a clicker, but if we go to the next slide, please. There we go. So just a quick overview of the program. The eligibility criteria, that changed this year. February of this year, we had new guidance. It used to be that you need to have 3 dependencies on activities of daily living, otherwise known as ADLs. What are we talking about? Things such as bathing, dressing, grooming, eating. You have a depiction of those on the side. So if you think of those, if there's a dependency of this, someone that otherwise would be in a nursing home placement or in an institutional placement, we try to provide assistance with these activities of daily living so they can stay safely at home. That criteria changed from 3 requirements of dependency to 2. So the VA actually opened up this program for more veterans to be able to participate, which is a great thing in my mind. Obviously, our service delivery, once, this is a consult-based program, so the very first thing to remember, if any of the veterans that you know or anyone that you encounter, you can think back to this program, make sure that they reach out to their primary care provider. That way they can place a consult for HHA for them, or home health aid program. The second thing is our service delivery. So the non-skilled workers that attend, they actually provide these services, are provided through VA contracted agencies in our community. And then those workers go into the home. So these are not necessarily VA workers, but these are workers, unskilled workers that go, and when I say unskilled, please, I don't mean that they don't know what they're doing, meaning they don't have a certification. They're not RNs or LVNs or CNAs. These are unskilled or trained personnel by these agencies that go in and provide the care for these activities of daily living. And then, of course, our evaluation process. The evaluation process comprises of receiving that consult from the primary care provider, which identifies the need for this veteran. And then from that, our nurses are the ones that process these consults, and they do a very thorough chart review. We do a thorough chart review because we try to look at our veterans from the lens of holistic care. So when we identify those areas, our nurses also try to identify other potential areas that may be needed for help and make those referrals or recommendations back to the PAC team as needed. Patient Aligned Care Team, PAC team, sorry. I use my VA acronyms and I forget sometimes. So just for those, the Patient Aligned Care Team that is taking care of the patient, which, if you don't know, is comprised of a licensed independent provider, a registered nurse, an LVN, a pharmacist, and there are other adjunct members like PCMHR, primary care, mental health integration, dietitians, et cetera. So that's the team that we make recommendations back to. In addition to that, we look at, again, what is the documented need, and then we complete a nationally mandated for this program case mix tool. Case mix tool is a series of 15 questions that are targeted at identifying the specific need for this program. And based on that, we get a case mix index. The case mix index is a letter grade that will give us a sliding scale of the number of hours that are going to be allocated for each veteran. I can go to the next slide. And if at any point you have any questions, please, I'm a talker. I can talk all day long about VA programs. So please, sir. Yes, Mr. Albright.
So I have a question about our elderly veterans that I noticed that they kind of fight the fact that they don't want to come to terms that they have those ADLs, disabling limitations. And then some of them have good days and bad days. On a lot of those days, they're unable to cook for themselves. Or some of them will tell me, you know, this really scared me, I forgot to turn the stove off, right? And I could have burned my house down. And then what we've noticed in El Paso, and hopefully there's no hope to it. We're trying to get after it. There's food insecurities here. So, you know, we don't have a good system to deliver the food to those that can't get out there. And when we do deliver the food, sometimes it's just a 5-pound bag of dry beans, and they don't know what to do with that either, and they have cooking issues. When you're doing your home health assessments, is anything about food insecurities or the inability for them to cook for themselves or potential memory loss problems to cook taken into consideration?
That's a great question. So this program specifically is for activities of daily living, such as I mentioned. we realize that cooking is very important. So light meal preparation is part of this, what we call some of those instrumental activities of daily living, or IADLs for short. Again, you have to, and it can't, the program can't just be for IADLs. You have to have a need for activity for the primary ADLs, and then some IADLs, or instrumental activities of daily living, such as light meal preparation. Are included as part of this service. We do encounter, sir, and that's why I mentioned that veterans have to accept the help, right? We do have oftentimes cases where the primary care provider or a provider identifies a need, they make the referral, we do the assessment, we see the need, and a lot of times my nurses have to just resort to their techniques, right? We call teach and MI, to their interviewing techniques to sometimes convince the veterans that, please accept the help, or accept it at least in a temporary basis. Give us a try, and then we'll take it from there. And a lot of times it's a conversation too between the caregiver or whoever is taking care of that veteran at home and the veteran themselves. Sometimes the veteran hasn't come to terms with needing that extra assistance, but we talk to the caregiver and they're like, no, that's not true. They do need that assistance because I'm providing that for them. So we do see those cases. We try to intervene, as much as we can by doing the care coordination piece and identifying additional needs where we can reach out to internally within our same programs or within the patient-aligned care team for additional services. We do have our social workers that we collaborate with regarding food insecurity. I know there have been some updates. We have programs such as Meals on Wheels. Several of our veterans are participating on that, although sometimes if there's a great need, they tend to have a wait list. They don't right now, but they tend to sometimes have a wait list for this program. But we do tap into other resources. I know the VA has, on Wednesdays, I believe, they have that meal distribution at the VA. And I just recently found out that our social work department is working to have an internal consult. It's a new process where they're gonna have an internal consult to be able to prepare, give meal supply when that need is identified. So that is something new. I haven't done it myself, so I can't really speak to the process itself, but I know that's something that as a VA we are looking at for food insecurity. You're welcome. Any other questions?
Has that program been launched?
Not to my understanding.
Right.
I think that's a new program for that internal consult. Now the meal distribution is still, it is happening and has been happening I can't speak, but for months. I'm aware of it because it's in the parking area and it's very visible for us, but I do not know when this will start. I can provide more information. I can have the contact person, Ms. Toya Banks would be the contact for that, but I can certainly provide, or Mr. Albright, I'll have Ms. Toya Banks give you an update on that program. I think it's well worth advertising outside as well. Okay. Okay, so again, one back, please. That's okay. Again, key requirements is accept the help. That's part of what we were talking about. It is important to remember in this program that it's hands-on assistance. Sometimes that is one of the limiting factors. A lot of times that we realize that there's need for companionship, that there's need for someone to just kind of sit there and, read with them or just have that companionship. This program is not for that. So I think that's one thing that is, I want to keep in mind, is hands-on assistance for those activities of daily living. For companionship or social interactions, we do have another program, which is our adult daycare. So that's another option that our veterans can take advantage. Sometimes veterans are not quite there at that point where they need major assistance with activities of daily living, or they may need slight assistance with that. And then we can match them up with a better program for them. Maybe they need that social component, maybe that light meal preparations, because they're gonna be provided 2 meals and a snack in an adult daycare. So that is always, and of course the social component, where you have other like-minded people, probably, sharing battle stories or an opportunity to have that social component at an adult daycare. And then, of course, the clinical evaluation. Those are the key requirements that we have for this program. And then the last slide here is just to kind of allude to the fact that under the NIC umbrella, we do have many other programs. So this is just one of the programs that we have. It does include respite, and respite is for providing precisely that respite care for those that are caring for veterans, for the caregivers that are providing the care, so we can provide some assistance to them and have this agency staff come in and provide those activities of daily living while the caregiver is taking care of whatever they need to take care of, whether it's just getting a break or going to a medical appointment, et cetera. So there is that component as well. But we also have other programs within the NIC umbrella. And if anybody has any questions, please feel free to ask.
Does anyone have anything for Ms. Escobar? No?
Thank you so much
Okay,
for the
thank you.
opportunity, and have a great day.
Thank you.
Thank you.
All right, item number 9, discussion, monthly update from VAC subcommittee chairs, and we'll start with Roberto Garza for employment.
Good morning, everyone. So the first thing I want to start with is we are going to take a slight direction change on the employment committee, not necessarily not working on employment, but we're going to try to focus on the child care issue. We know that, most families today are dual working families because it's just nature of the beast right now. And what does that do? We're making more money, but we have to spend more money for the daycare. So we got to try to figure out how we're going to attack the child care issue to ensure that our families are working, because right now maybe one family member has to work and the other one has to babysit, and that's a tight budget in our current situation where we are. So I had a discussion with our chair, and she was in agreement that that's the direction we need to go. We need to focus on that child care aspect in the employment realm. So we're going to move forward with that and see how we can impact that, at least for the city. Secondly, last year, Paul, we had recommended, based on different trade schools that I was going to, and we learned that the trade position, electricians, HVAC, they were having a hard time getting hired here in El Paso, especially HBI graduates. The one class I went to, one person had gotten a job, and even the number one graduate couldn't get a job here in El Paso. So there's a breakdown somewhere in the trade hiring position, especially the electrician. And we had proposed, we had even briefed it down in council, and then we briefed it to different staff. But we had proposed the city hold a trade job fair, not necessarily, a blue collar, but more specifically to the trades, because we know that many of our veterans coming out were hands-on in the military, and they want to stay hands-on out here, and that's just what they want to do. Just want to know if we can get some feedback on if we're still going to be able to move forward with that sometime later in the year concerning that trade fair.
Yeah, so I can address that right now. So I've already made contact with a trades academy, a school that was actually at the Borderplex Veteran Service Provider Resource Fair. They are willing to host the fair so that it becomes no cost to the city. And then we will work together to invite every trades out there to have a hiring fair for all the trades that are out there. So it is in the works. I will tell you that it's not calendared. It's not on the calendar yet, but we are moving forward. We've already identified a host who's willing to do it, so it's in the works.
Thank you very much. Pending your questions, that's all I have.
Just to confirm, has the subcommittee discussed the childcare thing just yet, or not yet?
No, the subcommittee has not discussed it yet, so
Okay.
that's going to be our main focus moving forward.
Okay, thank you. Anyone have questions for Mr. Garza? No? Okay, so next is Mr. Ron Jackson for homelessness.
Good morning, everybody. So there's a few updates, just so recent that a bunch of grants that we just received. the tribute to the homeless situation here in El Paso. One of them is the Salvation Army. They received $250,000 grant to go towards that. The YMCA is also $300,000 grant. We have Project Amistad with $300,000, and then another $100,000 for clinical counseling. So what that's showing is El Paso is actually making positive step forwards in trying to combat the homeless situation here in El Paso. We're actually doing a holistic approach. So what you're seeing is all these organizations is actually combining mental health with homelessness and substance abuse, which those are the root causes. One of the things that, talking to Rita, there are some initiatives and stuff that we're planning on trying to go forward with. I'm going to have another meeting with the team to see how we can support that initiative with the VA and everything like that. And Paul actually went to Washington, D.C. and got some information about the homelessness and how other organizations is running it, and maybe have some feedback on how we probably can change or.
Yeah, well, I was going to cover that during my update.
Oh,
Since
I'm
you
so
teed it
sorry.
up, I'll just go ahead and tell you. Why wait, right?
Right.
So it wasn't D.C., it was actually Houston.
Houston, excuse me.
But that might be bigger than D.C. anyway. It was the Texas Homeless Convention for the state of Texas. There was folks there from all over the state. So you got to learn a lot of different ideas and what they're doing in different areas. The one that I was very interested in and I learned a lot from was the the Houston Coalition for the Homeless, and the way that they track data and the way that they prioritize their homeless. It's not on a linear scale, and they actually use the data to prioritize, and there's specific criteria, and the way that they do their intakes is absolutely amazing. I won't go into 100% detail right now because I asked for a follow-up meeting with them so that we can learn more. But rather than, well, you've been on the list for 30 days, so obviously you're going to get the first house. This person here who might just came in might have a higher priority based off of their situation, in whatever situation that might be, that they may need to be housed a lot quicker, simply because of certain vulnerabilities or whatever. So they have a criteria and a data that pulls that in, and it's absolutely excellent. And if you know, the Houston homeless population is it's several thousand. So they're really getting after it, doing amazing things down there, the way they keep that under control. I also met with Tunnel to Towers, and if you haven't heard of what Tunnel to Towers is, it's a national, very large organization that is building veteran villages all over the nation. They have a veteran village in Houston. I toured the facility along with Adele Alonzo from Community Development, and her name's escaping me, but another one from Community Development. And we got to see exactly how they fund it, how they operate it with case management, with both tenant and permanent supported housing inside of the village, how they're expanding, and they're very, very interested in doing something right here in El Paso. So we're going to be in further conversations with them, and they expect to come down here and visit before the end of the year, so we can arrange to have a meeting so you guys can ask them questions as well.
Thank you, Paul. And one of the things that I found out doing research around El Paso is the numbers for our homeless veterans are not accurate. The last report that I've seen was 2021 from the Coalition from the Homeless. We just need to do a better job on how to track them all. For one, one of the issues is some of our homeless veterans are not being tracked because they're not service connected, which one of the things that Nana had brought up earlier. So we had to figure out a way of trying to get all our vets here in El Paso service connected. We have more vets here in El Paso than we think. That we know. So until we actually got that real number, we may not be requesting the amount of money or the amount of resources that we actually need to actually come back to the situation. So that's why I want to just bring up to your attention, ma'am.
Excuse me, that's interesting you bring it up because that's something the Opportunity Center mentioned and that the city didn't approve some additional funding because that they didn't have that data. Do we need to get in touch with the coalition's board, or is there something, some kind of support or something you need?
I'll answer that question. So I'm going to actually try to partner with them and try to see if I can get more involved and get some teams and stuff down there involved and see if they need any help to try to get some of these survey data. Endeavors is willing to help too. They actually do their own little survey and stuff like that. So we're going to try to see if we can get everybody, have a collective, everybody just bring all the data together so we can have one shot, one kill, and just handle everything. So when we requesting for grants and requesting for resources, we're accurate so we can actually get approved.
Okay, sounds good. And I'm assuming we're waiting on, not totally waiting, but we're a little dependent on the Texas legislature to address the landlord incentives so we can help with adding more landlords, right?
Yeah, that one still has a large hill to climb. So it's on the legislative agenda, but until it's actually picked up by an elected official to move forward into, it hasn't gone anywhere. But we have some traction on. There are some interest in it.
Okay, great. And I would like for, I know we're super early, but for the next priorities, add the childcare issue, because it's statewide, the lack of childcare. And West Texas is a desert. It's a childcare desert.
In the meantime, we'll continue to look through philanthropy and what we have right here to try to address the issue.
Yes.
Right.
There was one more thing. If I remember, I'll bring it back up. Does anyone, go ahead.
Paul, you briefed numbers before on homeless. Where do you get your data that you have? And then, because I know that we share, I know that there's a number somewhere that we have to keep a certain homeless numbers for so many years, even though they're housed or whatever the case may be. Can you talk about that real quick?
So the numbers that we receive are the point-in-time count that comes from the Coalition for the Homeless. The last time that I requested the point-in-time count numbers was back in June, and they weren't released to me for whatever reason. I don't know why. So I can readdress and try to get the point-in-time numbers. If you go to the State of Texas Health and Human Services and you request for the point-in-time numbers from the State of Texas, they will tell you to contact the Coalition for the Homeless. They don't provide them. And from El Paso to that website. But you can see numbers across the state over there. So it is a valid concern about data and why is it not shared publicly. And I think it does need to be addressed.
Regarding that, when you were at the conference, Paul, were there any Texas Veterans Commission personnel there? Do you know?
Right now, I don't know if I could tell you if there was TVC. There was over 600 folks there. I know that there was state level representation, maybe not in the veteran aspect. I know I saw the American GI Forum there, the National Outreach Veterans Program. Ruben Marquez's counterpart, he was there. And we also had John Martin came from the Opportunity Center, who's part of the Veterans Transitioning Living Center. So he was there as well. So we didn't have great representation from El Paso, but we did. As far as veteran representation across the state, I couldn't give you that answer. Yeah.
Okay, that's fine. The Texas Veterans Commission has a homeless department. So maybe that's something we can leverage too, in letting them know that we're having issues getting data, et cetera, et cetera.
So the other thing that I can tell you, and I don't know why it escaped my mind, but the VA's homeless from the Vision 17, that director, she was there, and she gave an outstanding presentation about the aging homeless veteran population and how we're addressing them and how we're trying to provide services to them and get them off the street. She was incredibly knowledgeable. And we made sure that we told her as well what a great job that Rita Garcia is doing down on our local level. And she said she knows Rita well. So there is good conversations going on between our VA and the regional Vision 17. So we know that there's some good things going on, but there is definitely a data flow issue that we see here in El Paso.
Okay, thank you. Does anyone have any other issues, questions, comments for Mr. Jackson? No? Okay, so we'll move on to Ms. Donna Juarez for mental health.
Good morning. One of the projects we worked over for the last quarter was to take our mental health initiative and put it on the website. And what we came up with was basically a wraparound project where we're looking at, of course, mental health. One of the first things that come to my mind is, to prevent people's lives from spiraling down to a point where they don't want to live anymore, or maybe have feelings of not having somebody else live. And so many of our suicides are knee-jerk reactions because of finances or trauma or conflict or marriage relationships. So when you think about mental health, one of the first things that come to my mind is like, how do we address that? So the committee came up with a holistic approach where you could look at every aspect of dimensions of our lives, from protective factors to holistic to medical to peer support to, of course, the counseling, the medication management, and it was a holistic approach. So Paul approached me about 30 days ago because we do already have a mental health website that needs to be updated. So what we're going to do before the next VAC meeting is take that whole wraparound service, that whole vision, and try to connect the two, and hope that, I see suicides just for the last 15 years on a regular basis. And I do believe without a doubt that wraparound process is going to give people a hope and a vision for the future. And there's so many cogs in the wheel of why somebody might decide that life isn't worth living. And I do believe that wraparound process needs to be as easy as possible, almost like a pie, where they're like, career, or my marriage conflict, or the trauma that I can't get out of my mind, and that they just click on that, and then it just gives them a plethora of options, and that's going to look different. One thing that the VA does remarkably well is their whole health holistic approach, but I can tell you from what I know, and if the VA is listening, that I know of, any veteran that's not service-connected or wasn't honorably discharged does not have access to their groups on coping skills in grief and seeking safety and anger management and insomnia and mindfulness. And earlier, Tracy said, hey, if you're not service-connected, that's okay, you can come on in. And my hope is that if you're listening, that they're gonna be able, just because they're not service-connected, might have access to those too. And if not, we as a community with the wraparound and all the resources, we can fill those gaps. So we just need to have those honest conversations. If it's not available, where at? And most people aren't going to get the help unless they have easy access, and the location. There's too many resources here in this city that we can't say, okay, we may not get that for those people that aren't service connected, but let's look at this city and let's work together. So I think with our subcommittees, that's the vision that we have, and our goal is to take that wraparound, merge it with the homework y'all have done in the past years. One of the things that I would like to say is, I used to, believe it or not, you probably wonder when, I worked at the YWCA once upon a time, and when they went up and received their $300,000, a lot of that went to daycare and having access to daycare. So I'm assuming that that's one of the people that we should talk to. One of the other phenomenal things, I think, Paul, you were looking at me yesterday when TVC gave $500,000 to the West Texas Counseling and Guidance, and we were all like, where are they? And I think they were in San Marcos or San Angelo, but they offered right there on the spot telehealth. So we know there's resources that, and then here's the other thing. November the 12th is the end of the TVC new grant. We all need to be talking to our local folks who do phenomenal jobs, great accountability, great out there in the community, and they need to apply before November the 12th, because I think we should have heard somebody from our local area standing up and getting $500,000 or $300,000 for mental health or for the daycare or for some things like that. But you know what was wonderful is that they said anybody can use it. Not just San Angelo, anybody. And they did some things that I thought was remarkable. 44 therapists? Wow. What an amazing, so I can't wait to merge the two, Paul.
So I did, just to address that right there, there are some local ones that did get the TVC grants, but they don't present the check to them because they're a renewal, right? So Veterans One Stop is still operating on their same grant, and so is
Amistad?
Endeavors, right? And Amistad got a renewal, got a new grant. So, so when you get a renewal, you don't always get the big check.
Oh, okay.
So
Well,
we got the big check at Sun Metro, even though it was a renewal, because we got it expanded. It was bigger. We got it
Okay,
doubled.
and I'm always telling everyone, and it doesn't matter if you're active duty, veteran, not service connected, Amistad, Endeavors, Veterans One Stop, Vet Center. You may have to meet a little bit of the criteria, but you can walk in and you don't have to wait. Now, if you're service connected with the VA, they really want to embrace you with their whole health wraparound, and it sounds like today, anyone can go, so we can't wait to see how that rolls out. So, thank you, and if we can just make a difference in one life, that's what matters.
Thank you, Donna. With that said, I'll state it to the public that if you want to see who the grantees are for the Texas Veterans Commission, you can go on the Texas Veterans Commission website. I think it's simply tvc.gov, TangoVictorCharlie.gov, and you go to grants and you can see all the grantees in your area, and it'll list everybody. And that's what I do. I do work for the Texas Veterans Commission. If I have someone who needs a resource that we don't provide, I'll look on that grantee website, see who can possibly, and here's who you can. Like someone needed a home repair. Here's a few resources that may be able to help you. So that would be a good point, especially for mental health. And yes, I've heard the grant application is very easy. I don't know, I'm not experienced with it. I just know we have grants, and Paul says no. I don't know, I've heard it is. So yeah, and if you need help with that, just let me know. But does anybody have any questions with, for Ms. Juarez? No? Okay, great. Thank you, ma'am. All right, so we'll move on to item 10, discussion, proposed VAC bylaw changes addressing the following. A, officer term limits. B, committee and subcommittee attendance. C, updated regulatory language to conform with the VAC resolution. So in front of you, you should have those proposed changes. And are you going to lead that discussion? Okay, thank you.
Okay, so there's two things in here that are proposed to go on there. That is completely up to you. The other two are mandatory. They're going to change whether you vote on it or not, okay? And I'll go into that in more detail. Okay, so the officer term limits, that's completely on how the VAC wants to run and how you want to do your business. So if you will turn, and everybody has a copy of the red-lined bylaws in front of you. If you turn to page 5, and I know the page numbers aren't on there, I apologize, so, but it is the second to the last page, where it says Section 1 Officers under Article 4. It says VAC officers are chair, vice chair, secretary. Officers will be elected in the first VAC meeting of the calendar years. Officers can only serve twice as an elected officer throughout their term. Now, the purpose was to allow more participation from the other districts to take a leadership role on the VAC. All right, that was expressed by Melissa and the other officers to present to the VAC, to allow that to be voted on, to see if you want that language included into your bylaws. So now, what I've noticed is that I've put discussion on here. It's not discussion and action. So this isn't something you're going to vote on today or even take a motion for. We're introducing it to you, all right, and allowing you to discuss if this is something that you would like or not like, and then we will come back next month and we can actually vote on this. Okay, so with that being said, discussion on the officers' term limits.
Anyone have anything?
I like it.
Yeah, I think term limits make sense, not only for the VAC, but in other places in government. So I think it gives other districts an opportunity to take the lead.
Yeah, I agree. I agree with that as well. It gives other districts the opportunity to have their time in the leadership roles as well, so I think it's good.
I agree too. I serve on other platforms where I think new ideas and new exposure and gives everyone an opportunity to be able to share that with our community.
Okay, if there's no other discussion, we can move on to the next change.
Okay, so the next change, it's two parts, committee attendance and subcommittee attendance. The committee attendance is governed by the city code, all right? The city code, that is, if you miss 3 consecutive meetings, if you're absent from 3 consecutive meetings, is it consecutive or is it 3 overall? I think it's 3 overall, so I'm gonna get rid of that word consecutive in there. It's 3 overall. Once you miss 3 meetings during your term, it automatically generates a letter that has to be written by the chair, and it's sent to the mayor and city council that you are missing meetings, okay? We've had several missed people that are missing meetings, okay? So there is an accountability piece to this. You need to be aware of it. You need to understand it. It has to be in our bylaws because it's part of the city code. All right, so that one's going to get written into it. The next one is subcommittee attendance. Okay, subcommittee attendance, right? So subcommittees isn't in the city code. Subcommittees is something that you came up with. This is in your bylaws, so this is going to be a matter of discussion and a vote if you want it in there. Okay. So if a member has been absent for 3 consecutive subcommittee letters, a letter will be sent to mayor and city council for their visibility of excessive absences. The VAC may waive subcommittee attendance reporting requirement where it determines extenuating circumstances provided a reasonable excuse for such member's absence. So you can say, well, it's excusable. Unlike the committee attendance, where it's not excusable. There is no excused or unexcused, okay? The VAC shall not waive, it's right there, shall not waive committee attendance reporting requirement because it's part of the city code. VAC members that are not present at monthly committee meetings and subcommittee meetings will either be excused or not excused by a vote by the committee as an item on the agenda during the first regularly scheduled meeting following their absence. So every agenda item, towards the end of it, we will go into attendance. And if somebody missed the last meeting, you will vote whether or not to excuse or unexcuse it. The reason we're going to do committees as well on that one is it's good to be able to put on that letter that the VAC excused them 3 times because they were with COVID or they had a death in the family, right? There's kind of an extenuating circumstance. The letter still has to be generated, but it's nice to track that there was an extenuating circumstances that allowed you to miss the meeting, okay? So that's why we'll vote excused or unexcused still, but the letter will still get generated for committee meetings, okay? So with that being said, discussion.
Paul, for committee attendance, if we're going to attend virtually, that has to be notified to you or to the chair prior to execution of business, right? If I show up halfway through the meeting virtually, there's still no quorum, there's still...
Yeah, that has to go with, and correct me if I go the wrong direction, but we have to have complete transparency to the public, and that's why the agenda is written. It says it's going to be hybrid, but the way we put on there is these members will be virtual, so they'll know that there's a reason you're not here. You're virtual, and it goes on the agenda. Notice there's nobody on this agenda that says they'll be virtual. Everybody's present, right? Because nobody told me that they were going to be virtual. But for quorum's sake, you have to be physically present in the room. Even if you're virtual, you're not helping to make the quorum. Do they still have voting rights?
Yes, so
Okay.
as long as there is a physical quorum present and you appear virtually, even the 30 minutes into it, you would be allowed to vote on that items that you are virtually present for, provided that there's an existing quorum already. And just so you know, if you get up to use the restroom, the quorum doesn't break or anything, it's still a quorum.
Do we want to write that, I didn't, maybe it's already in here, the virtual piece, but do we want to write that in the bylaws? Or are we just getting too detailed?
Yeah, I think that's more like instructions, right? And I think that's just, maybe we can write it in under the quorum piece that says virtual does not count as part of the quorum because you're not physical, but it is in the Texas Open Meetings Act. All right, so if you looked at, and you did the training on that, which everybody did, okay, it's in there, okay?
Thanks, Paul.
Did you have? For the subcommittee attendance, I also think that one should read overall, 3 overall absences as well.
Yeah, it's in there. It says, subcommittee, a member has been absent for 3. Oh, you want it to be overall, not consecutive?
Yes.
Got it, okay.
I suggest
Yep.
it should be overall as well.
Yeah, so that's up to the discussion.
Yeah, I recommend that as well, because, you know, sometimes we use our Waterpex conference or wherever we're at, we're all together, and that turns into a meeting sometimes for our subcommittees, and we're not always in the same place, so I think it's better that for the subcommittees to 3 overall, not consecutive.
Anyone have any further comments? Go ahead.
I just want clarification. So when someone's absent, no matter what the circumstances, there'll be a letter generated, and then this committee will vote whether or not it's excused or excused. Once there's 3 unexcused over the period to 2027, then that's term, I mean, just, was that term, and you start looking for a new?
No, not exactly. So,
Right.
so what it is, it's, you can't be removed by this committee. You have to be removed by mayor and council, okay? Because you were appointed by mayor and council. Not just your city council member appointed you, but then it had to go to a vote of all mayor and council to approve that. So this committee cannot remove you. But it isn't whether it's excused or unexcused. When it's committee meetings, 3, whether it's excused or unexcused, is an automatic letter generated to mayor and council that you missed 3 meetings.
And so it's
And
just
then
like
they
a-
make the decision. Your council member can make that decision. Hey, you know what? Paul is missing way too many meetings. We're gonna go ahead and remove him. We're gonna put it up for a vote to city council that he be removed and replaced with a new person. Is that correct?
Yes, that would be correct. It would go to council to make the final decision.
Okay,
Now we
which
gotta
makes
check with
sense.
the lawyer, right?
Because at the end of the day, you're representing that district, and then you need to be there to represent it. Okay.
Yeah, that's what the one thing that you have to understand, when you take this position, you are representing those constituents in your district, and your city council member is really relying on you to represent all things veteran-related for his constituents, whether they're a veteran family member, or just a concerned citizen. Yeah.
Thank you.
For those subcommittee meetings that we don't have attendance, are we reporting it to the chair or reporting it to you? How's that work? Who do we report to?
Whatever you guys, you tell me.
Well, what I did in the past, like when I was chair of homelessness, I reported it to our chair, our committee chair, when we had someone who was just not attending the subcommittee meetings, and he was the one that he initiated I guess he took it as if he initiated a letter like this, and then that person was removed. So if that sounds like something you all think is fair and balanced, we can do that. Or at least maybe, let me know, and I can let Paul know, so he can formally record that.
Yeah, absolutely. So we are required to provide administrative oversight to the VAC, okay? So that's what we're appointed to do. So if you tracked it and let us know, because we're providing administrative oversight, we will help track that for you, okay? You just gotta let us know whatever system you come up with to allow us, because we don't always know when your subcommittee meetings are. So we wouldn't know if you missed it or not, and we're not always invited to them either. I don't know why, okay? But Yeah, by all means, however you want to track it, let us know. We'll help you continue to track it for you, okay?
And then lastly, I would just like to say that in all fairness to my committee, I'll make sure that our calendars agree before we stamp and seal the commitment.
Sounds good. Okay, any other discussion?
So just for clarification, I have my meeting tomorrow. 2 of us show up. I report the other 2 to you that didn't show up. That happens. She reports it to you. You guys are tabulating, keeping count. Then the 3rd one happens. The letter is generated. That letter goes to the council at that point. They vote whether to keep you or remove you, roughly, right?
No, it's completely up to the city council member what they want to do at that point. Yeah.
Yeah, we're gonna make the decision.
Yeah, but not all of city council. The
Got
council
it.
member makes a
Got it.
decision of what they want to do.
Yeah, it doesn't go up for vote.
Right, it's not like once the letter's generated, boom, we're gonna put it on city council agenda and we're gonna make, no, it doesn't happen like that. City council does become aware of it. The council member that appointed you will see it and be like, oh, why is Paul not showing up to meetings? Let me go ahead and call him up and see what's going on. Okay.
Yeah. Okay, thank you. Any other questions, comments, concerns? No? Okay, we can move on to the next one.
Okay, so the next one is to update regulatory language to conform with the VAC resolution. And what we're putting in there is, it's actually pretty simple. It's the, it's Article 6 under reports, where it says semi-annual report, now you do it annually. And the last change is on the very back page, instead of it saying chairman, we just say chair. That's the other regulatory language that needs to be changed.
Any comments? No? Okay, sounds good. So we'll take a look at this. Can we, well, I guess on item number 14, we can add a proposal to vote on it then. Okay, so I'll wait till then. Okay, so if there's no other comments or questions, we'll move on to item 11, discussion action, vote to excuse or unexcuse absent VAC members from previous meeting. So we have according to the minutes, the members absent were Brian Canoff, Ruben Ramirez, Ron Jackson, and Donna Juarez. So did we have prior notification from any of them?
Yes, all of them prior notification, yeah. Yeah, for last meeting, absolutely, all of them did.
Okay, and Mr. Rosales was present?
He showed up a little bit late,
Okay.
but he did come in, yes.
Okay. All right, so I missed that part. Okay, so,
I make a motion that since they were prior notification, I make a motion to excuse those absences.
okay, do we
I
have a
second that motion.
Go ahead.
No, go ahead with your vote. I'll just, well, no, before you vote, because it's part of the discussion, I do recommend that not only notify myself that you're not going to make it, the officers as well, okay? Make sure that the chair, the vice chair, and the secretary knows that you're going to be absent. Anything can happen to me at any moment, right? You don't want me to be the single point of failure, okay? So make sure the officers know.
Thank you. All in favor of excusing all the members that were absent in the last meeting? Aye.
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 Anyone opposed? Okay, motion approved. Next item is item number 12, Division of Veteran and Military Affairs update.
I gave most of my update already. Covered the homelessness piece already. To let you know, we did not receive the grant for the aerospace training center. We will get an outbrief here in October of exactly why that didn't happen. We thought we had a very strong application, so we're very curious to find out, but we will get an outbrief from the Office of Local Defense Community Cooperation of why that grant did not go through. We are getting ready to submit several other critical infrastructure grants, one of them being for the replacement for Fire Station 12, which we did receive a $4 million grant to build already federally from Congresswoman Escobar's office. So now we're going to request another $2 million to finalize to build Fire Station 12 responds to Fort Bliss and the lower Worland Beaumont area and the Fort Bliss housing area over there. So we're got that right now. Fire Station 12 is right behind Chico's. And yeah, there is a building back there. It's pretty small. It's only, I think it has 2 stations in there. So we're going to make a much bigger one with much more capabilities. So that's the grant focus on this. The as far as veterans, thank you all that came out to the Borderplex Veteran Service Provider Summit. That was a great opportunity to learn. It was a training event. We had great speakers there, great panels, good information went out, and the resource fair was absolutely outstanding. I think we probably had, I would guesstimate 500 people that came through there, a lot of resources presented. So really good. We'll do another one of those. This one will be open to the public, and the audience are veterans, and that'll be in March, March 21st and 22nd of 2025. Same location, the Starlight Event Center. I do have some more travel coming up, a lot more travel. So in October, I am going to DC this time, Ron, okay? So this time it is Washington, DC. And this one's for the Association of the United States Army Conference. And then then I will be traveling to San Antonio for the Association of Defense Conferences 2 weeks later for the Installation Innovation Forum. And I am traveling with Fort Bliss Garrison Commander for that conference. So continue to bring back great information. If you don't know, we have advertised on the city's website for the Veterans Program Coordinator. So that position can be applied for as of today. It will be closing in the next week or so. I have been told that there's an overwhelmingly amount of people that have applied for this position now. So I will be busy looking through quite a few applications in the next few days. We will do interviews, and we hope to bring somebody on board here very soon for that position. Subject to your questions, that's all I have for an update.
I see 2 people I've never met before.
Oh, thank you very much. Okay. So behind us are 2 Bridge Fellows, okay? So the Bridge Fellows behind us, and I won't have them introduce themselves because they're not on the microphone. All right, you have a transitioning First Sergeant Morales, Jesus Morales. He's getting out, and he's actively looking for employment right now, okay? He's got degrees in emergency management. He's absolutely, so far, I've been impressed with him. And the other one, Ruben Hernandez Jr. is coming to us from the Navy all the way from Virginia. That's the reach of the Bridge program. It's outstanding, so he found out about it. He's an El Paso, and he's coming back home. He's transitioning out. His background's in IT, did all kinds of IT for the Navy. And so he's coming in here, and he's actually looking for employment too, but he's still got to go back to Virginia to clear and to get out and come back here. So both of them are going to be working in the Military and Veteran Affairs Office, all right, so we can help to connect them. We also have 3 other Bridge Fellows out here, okay? 2 of them are female, okay? So one of them is a military spouse. Her background's in medical and IT, and she's being assigned to public health. The other one is Stacy DeVerse, and she is being assigned to HR. Her background's in logistics, but she's very interested in HR, and she's got a master's degree already in social work. She wants to do HR, so she's being assigned to the police department HR. There's a lot of stuff going on down there, a lot of projects. And then the last one is Jason Sneed, whose background is in accounting and banking. He was actually a banker before he came in here out of New York City on Wall Street. Joined the military because COVID, everybody started getting laid off left and right. He was one of them, so he said, well, I'm going to be a soldier. He joined the Army. Now he's transitioning out, and he's going to purchasing and strategic sourcing. So we have 5 in this cohort. They'll do a little 90 days. The next cohort will be in January, and we'll pull another 5 to 10 in. I think 10's my max to be able to take care of at one time. So 5 to 10 is what we'll pull in. That's who those are in the back of the row.
Thank you. Welcome. Congratulations. I know it's not a real job just yet. I'm just kidding. I know it's an internship, but I think you'll learn a lot. Does anybody have any questions, comments, concerns for Paul? No? Okay, thank you very much. We'll move on to announcements. Item number 13, limited to veteran and military events pertinent to the El Paso region.
I have one announcement. As some of you may know, one of my passions is scuba diving. And as a result, I've come in contact with an organization called Dive for Vets. It's based out of Fort Lauderdale, Florida, but we do have a contact here at a place called Aquatic Adventures that runs dive for veterans in the local area, and it provides one free certification for veterans in the community, to include open water certification to any veteran that is interested. So I would like to have that individual, that representative in the future. I'll talk to you, Paul, about come and brief that program, but it's a great opportunity. It's a free opportunity for veterans to get certified as an open water scuba diver. And it's a very awesome program. It's very cool.
Hey, do not need to talk to me. Item 14 says proposed agenda items.
Item
We're not
14.
on 14 yet. Okay,
Yeah,
just
roger
keep-
that. It's a nice segue into item 14.
Anyone else? Any events? Go ahead. Please speak into the microphone, sir. Thank you. No problem.
Thank you. We throw around numbers frequently, and one of the numbers that we throw around is those veterans in El Paso County that have not come to the VA and become a part of the El Paso VA. And I've become acquainted with some, not some, but a few of these that just flat don't wanna. You know, Ruben Ramirez and I are both members of the El Paso Athletics, what do you call it? The Hall of Fame. We're Hall of Famers. Both of us in the same category as photojournalists, career photojournalists. Well, any of you baseball fans will know that when you come to bat, they give you walk-up music now. You select a tune that you're familiar with, and that's your walk-up music. So when it's played, people know that you're coming to bat. Well, we initiated this with the Hall of Fame and the new bunch of Hall of Famers this year. One of the walk-up music was Ballad of the Green Berets, and I'm going, wait a minute, I didn't know this guy was a Green Beret. I thought I knew all the guys that, you know, in the special forces retired in the area. And his name's Kenny May, and he was Vietnam 2 tours, SF, I mean Purple Heart, you know, Bronze Star, the whole thing, the hero. And he just flat doesn't want to take anybody's tax money to help him with his medical future. He has great insurance, and he's good with that, and doesn't want to be a member of the VA. So I'm just saying that when we deal with these numbers of those that are out there that are not affiliated, there's a percentage that just doesn't want to. I just thought I'd mention that. One other item that I'd like to see a Texas flag standing next to the American flag when we meet in the future, if that can be done.
So for this particular item, it's related to events that are going on.
I'm sorry,
That's
I thought it was
okay.
anything else.
No, it's events that are going on. Could that be for item 14? For the flag?
No,
No.
you'll ask.
I
and
just
I'll-
thought we
I'll-
got to the end of it, and was there anything else? Well, this is the two anything else's that I had.
No,
Yeah.
we're still on item
I
13.
can, I mean, if you just talk to me directly
No
on
problem.
that, I can attempt to procure a Texas flag. Yeah.
Shouldn't be too difficult.
Thank you. Does anybody have any events? Go ahead, Ms. Juarez.
Okay, the events that I want to shout out loud and clear is that there's a veterans fishing trip that the Elks Lodge has been doing every single year. And we take, probably about 40 veterans out to, many of them fish for the first time, many of them first time to get on a boat. I just sent a copy of what that looks like, and they're taking reservations. Now, if you're able and you just want to come and support those veterans that could never probably have that opportunity to get out to Elephant Butte, fish, and get on a boat, we do need people that wouldn't mind having a vet ride with them down there and just come join our barbecue. Everything's totally free except just getting down there. We do have lots of vans, but if you happen to be somebody with a vehicle and you want to take a veteran, those are those social connections that we talk about. And so that's coming up, and that is, on September the 28th. And hope to see people there. Also, there's a TVC resource fair on September 26th from 9 to 1 p.m. At the main VA. They're doing Breaking the Silence. And lastly, I'd like to talk about the September 23rd is the VA's announcing who won their suicide prevention art contest. So lots going on in the community, and just get with us and we'll get you that information.
Any other events that anyone would like to share? This Saturday, the El Paso, Texas Women Veterans is meeting from 9 to 12. They meet at the Women's Club of El Paso, located at 1400 North Mesa. Parking is catty corner to that club. And thank you for sharing the TBC resource fair as well. And I don't have anything else. Anyone else? Go ahead.
This is not a veterans event, but it's a family event. And, we need those types of events for our families. In Socorro on Saturday, they're having their Harvest Fest, 2024 Harvest Fest. That is from 5 to 10 p.m. If you like music, DJ Johnny Cage is going to be there DJing that event. So what a great opportunity to support the small community of Socorro. 5 to 10, 901 North Rio Vista Road in Socorro, Texas. So definitely take that opportunity to support them and have an opportunity to spend some time with your family. Saturday, September 21st.
Any other events? Go ahead.
And so this morning at 2:30 in the morning, I was at the airport to receive the honor flight who just flew out to Washington, D.C. 33 all Vietnam War veterans, male and female, okay? They flew out this morning at 05 in the morning. They return. And this is where we would love to have you there to greet those when they return. Their plane lands at 4:45 p.m. Saturday, September 21st, 4:45. Please be there a little bit early as parking gets very difficult, okay? Your parking can be validated, so you don't have to pay for parking when you leave out of there, okay? They'll have a desk set up for validation of parking. We'll validate your parking. But come on out there, get your signs, get your flags, welcome home these Vietnam War veterans, because all 33 of them did not receive a hero's welcome when they returned from Vietnam, however many years ago it was, okay? Cool.
I'll be there.
Great.
Anything else? Okay, so we'll move on to item number 14, discussion on proposed agenda items for next meeting.
Propose to add Michael Robinson to the next meeting from Aquatic Adventures so he can brief Dive for Vets. And I guess that would fall under item 8, community update.
If he's like he knows that it's only going to be a 3-minute introduction, then it's great to do citizens comment. But if he has a good overview, then it would be good to
Okay.
do it. So we'll discuss to see where he fits in best.
Very
We'll
good.
get it- We'll find the right spot in the agenda.
Awesome.
I think Brian was interested in eligibility and enrollment and VA outreach. That's what it sounded like earlier.
Is that something you'd like to add to the agenda?
We
Yep.
can discuss the 20,000, how they come up with them, how they find them, where that number is at, and what we're doing to reach them, and how much do they understand that some of them just aren't interested.
Right, I think that all I wanted to do is to bring to light the fact that even though it's a large amount, there is a percentage of those that don't wanna. that don't want to be, that don't want to have anything to do with the VA for personal reasons, for financial reasons, for whatever it is. And I just happened to run into one that, you know, that is prominent in the community, and he just doesn't want to have anything to do with the VA. And there may be a certain percentage of those that exist in that, so the gross numbers that we have may be a little inaccurate, that's all.
Well, I would say that the number that they're not connected is accurate, but the
Oh, no,
purpose and the
yeah.
reason behind it,
Right,
we
right.
don't always know the circumstances
Right.
behind why they're not.
No, but I mean, if the goal is to reach every single one of those that are not involved, well, that's.
An unrealistic
Yeah, that's a
goal,
little
right.
unreasonable.
You're not gonna reach
yeah.
everyone, okay.
Okay, thank you. Any other proposals for next month's agenda? And a reminder, it's our second to last meeting. November's our last meeting.
I'd like to ask the YWCA to come in and share how their daycare program is working, and if it's still working, if you want me, if I could call them and see if they're interested. I think since it's a hot topic, it would be nice to know how it's currently functioning, if there's still any funds left, and with the new funding, how much is that going to be available for veterans?
Okay, sounds good. Is that something we can add as well? Okay, thank you.
Well, so what it is, it's your agenda, right? So as you give me these ideas, I reach out to these organizations. If they're eligible and they can do it, if they're interested in doing it, I'll make sure I let you know. But we always have to keep that timing in mind. So like right now, with those three, that would be 45 minutes if they just spoke 15 minutes each. So we would have to make a decision of who would go this month, who would go next month. But it's good to have this, you know, because it's yours, it's your idea. So,
Right.
yeah, this is great.
And I would suggest for the why too, maybe you could have them brief the employment subcommittee first, see if that's something they can do as well. And then if you feel like the whole VAC should know, which they should, and the public as well, we can move it into that as well. There's something to consider. Any other proposals? Okay, so we'll move on to item number 15. Our next VAC meeting is Thursday, October 17th, 2024 at 10 a.m. Item number 16 is, do we have a motion to adjourn?
I motion to adjourn.
Second.
All in favor, say aye.
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 Anyone opposed? Okay, and we are adjourned at 11:29.